What is the shocking truth between the menopausal transition and your depression or depressive symptoms? Well, one, it's a lot more common than you think. And two, your hormones are playing a big role. Hi, my name is Dr. Carrie Jones, and I am a women's health and hormone expert. And I also am going through the perimenopausal transition, so I get it. My whole goal on this channel is to help educate you so you feel informed and ready to take action. Hit that subscribe button because you're not going to want to miss these videos. You see, the thing about depression or depressive symptoms is that depending on the research you read, 40 to 50% of women check the box yes. Yes, I'm having mood changes. Yes, I have low mood. Yes, I'm feeling depressed, or I've been actually diagnosed with depression. Maybe you didn't have depression or depressive symptoms heading into this transition. Maybe you did, but it was mild, or maybe you did and it's gotten a lot worse. Either way, these hormone shifts play a role in that. Let me give you a couple of examples. To make one of your brain hormones known as serotonin, you have to get from tryptophan to 5-HTP. That's the first part of the pathway. You need estrogen to do that. And if your estradiol is declining, estradiol being your big main potent estrogen, but if it's declining, you may have less stimulation to get from tryptophan to 5-HTP. That means 5-HTP can't get onto serotonin. Now, yes, you might be thinking, you mean 5-HTP like the supplement? Yep, you make it in your brain as well, and it is the precursor to making the neurotransmitter serotonin. Estrogen also plays a role in dopamine. Estrogen also plays a role in oxytocin. Oxytocin is our love hormone, our bonding hormone, our community hormone. So if you have been feeling less connected, less bonded, maybe more introverted, less caring, that decline in estradiol can also cause a decline in oxytocin, and you can't get your groove back. You're feeling kind of like blah and depressed and down in the dumps. There was a study that just came out April 2024 in Menopause Journal where they looked at 170 women, and of the 170 women, 62% of them reported depression as they're going through the perimenopause-menopause transition. They were going to the clinic for menopausal hormone therapy and got a significant amount of them noted after 3 and 12 months, their depressive symptoms got so much better. When the body was given estradiol, it did support serotonin, dopamine, oxytocin, etc. Now, the other hormone that doesn't get talked about enough is progesterone. Progesterone tends to decline when you don't ovulate anymore. And women going through this transition tend not to ovulate anymore. It's one of the first hormones to go down. Progesterone, when it breaks down, it turns into a metabolite called aloe. Not like aloe the plant, it's A-L-L-O, aloe. And aloe goes up to the brain and touches on or supports your GABA receptors, G-A-B-A. GABA is very inhibitory, very calming. So not only might you be feeling depressive symptoms, you might feel more anxiousness too, less patience, more irritable. So when we combine the change in estrogen with the change in progesterone, this can lead to a whole lot of mood symptoms. Conventionally, what is often offered are an SSRI or an anti-anxiety. So we have the serotonin selective receptor inhibitor, or we have something that can calm down anxiety, right? So SSRI or SNRI for N is norepinephrine, and then we have anti-anxiety. But it could be just due to decline in hormones, therefore an indication for, hey, maybe you need hormones. Maybe you need to go on some hormone therapy, given that you're in this transition. There's nothing wrong per se with going on an anti-anxiety or an SSRI, something for your serotonin. However, if we know that the hormones are playing a role systemically, including in the brain, including in the neurotransmitters, consider the study that was done in Menopause, the Menopause Journal, where they gave them menopause therapy, the hormone therapy, and at the 12-month mark, they were noticeably better, noticeably improved without the use of an SSRI. Now, you may also be asking, well, what about taking tryptophan? What about taking 5-HTP? And absolutely, those are a consideration. Please talk with your practitioner about that first. Do know that tryptophan and 5-HTP, though, are not going to help with the other systemic effects that might be occurring in your transition. They may not, of course, help with bone loss or other brain changes, cardiometabolic changes, hot flashes, night sweats, etc. Will they potentially help improve your mood? Yes, but definitely talk with your practitioner, and especially talk with your practitioner about the consideration of hormone therapy if they haven't yet, as it relates to your menopausal symptoms and everything that is going on. So I hope this short little video was helpful in understanding that if you have been noticing more depression or depressive symptoms as you're going through this transition, you're not alone. As I said, depending on research, some 40 to 50% of women report the same thing. They're saying, yes, me too, I'm having this. And it is often due to the decline in these hormones that we can replace with hormone therapy, if that's an option for you. I just want you to be educated so you know all your options. Hit that subscribe button. I'm going to keep educating all about this menopausal transition so you have all the information and you can make informed decisions for your health.